Hi, we are starting a campaign to help educate more Medicare beneficiaries about their health insurance options during the very busy annual enrollment period, which is coming up very soon. We want to help deliver a healthier client to your clinics, and that means not just their health, but also their financial health. And so our campaign is to help educate about Medicare Advantage. Most patients are only aware of Original Medicare. Original Medicare, also known as fee-for-service, traditional Medicare, A and B, does not include many of the benefits that you'll find under Medicare Advantage programs. Medicare Advantage can only be sold, enrollment is very limited, and most people typically can move into a plan or change between plans only during the busy AEP window, which is October 15th through December 7th this year. So our campaign right now is underway this fall to help educate your members, your patients, about their options. We're not selling for any specific insurance company. We work with a network of independent insurance agents all across the nation. These agents are all independently licensed with a variety of insurance companies, being able to offer your patients a variety of options for their insurance needs. We find that our agents represent typically the top national and local carriers in every market, and that they'll work with your patients to help make a recommendation based on what's in network, what special services they need, what extra benefits might be attractive for them. So we know that the period is a very short window. It's October 15th through December the 7th. We can actually start discussing benefits, what the actual plans for next year look like, on October the 1st. It's highly regulated by the government. So we can't talk about it prior to October 1st, and after December 7th, when the AEP ends, there's very strict rules, very limited exceptions, how people could continue to enroll in a plan later or could move out of a plan and back to Original Medicare. That's what our agents specialize in. What we would like for you to do is encourage your patients just to call to ask for more information, just to become more educated about their options. So the one thing we want you to know is why this would benefit your patients. Medicare Advantage, in most cases, has more robust benefits, more to offer than Original Medicare alone. So the first benefit is that it does incorporate the Part D. The drug benefits are incorporated in most Medicare Advantage programs. They're called MAPDs, Medicare Advantage with Part D included. You get a lot of press with all the plans that are zero premium per month. That is very interesting to most people, and many people should explore if there are zero premium plans in their area. Of course, there are plans that are all price ranges between $0 and $100. Most people that have purchased a Medicare supplement typically find they're paying more than $100, $150 a month just for their supplemental insurance. And on top of that, they're paying for a drug plan, which is going to be another $20 to $40 a month typically on top of that. So a Medicare Advantage generally has a lower fixed monthly premium, and that's something that many people are very interested in this economy. But it has extra benefits. And what are those extra benefits? How does that benefit the patient? Transportation. Transportation is a very attractive benefit because if the patient can't get to the doctor's office, can't get to the pharmacy, they're not getting the care they need, they're not the healthiest patient that they can become. So transportation is extremely popular. And when I talk about the benefits, I'm not talking about any specific company or any specific plan. That will be up to the agent educating that client in the market that you're in. And so you won't find transportation or the same amount of transports available in every plan. It does vary, but it is extremely popular in the Medicare Advantage arena. What else is popular? Of course, the drug benefit, the MAPD, the drug benefit being rolled into that lower monthly premium. And you'll typically find the formularies very similar and the drug copays very similar. So, other benefits? Dental, vision, hearing. You typically won't find any of that under a Medicare supplement or other health insurance plans for people over 65. They don't find that in their group insurance plan anymore. Most Medicaid plans have cut that. Dental is a very expensive equation for most people over 65, and they're very interested in learning if they do have any options under private health insurance. And many Medicare Advantage plans offer dental. Vision. Original Medicare gives you a little vision benefit, but it basically only covers cataracts, macular degeneration, and glaucoma. It doesn't pay for a well visit, an annual well visit, to get your eyes checked, get your prescription for your contacts or your lenses updated every year. So people are very attracted to that benefit, the vision. Of course, hearing. Hearing aids are very expensive. Cheap hearing aids about $800, top of the end is about $5,000. And Medicare doesn't pay anything for hearing. So private insurance, you'll find many plans that give discounts on hearing aids. They give free hearing exams annually and all things in between. Depending on your market, you might have a very robust hearing benefit. You might have more of just a discount plan. But it's very typical that you're going to find dental, hearing, and vision benefits. Health clubs, another benefit you're going to find in Medicare Advantage. And what you might think initially is my patients don't go to the health club. They're not in that position. You'd be surprised how many do go to the health club. Many people are rehabbing for other illnesses, and it's quite a social event for seniors. We've found that they really enjoy the atmosphere in the health clubs. There's a lot more going on there than just working out. People are going there to be educated and to interact with other people their age. The Silver Sneakers program is widely popular across the nation. You can go to silversneakers.com, type in your zip code. That gives you some idea of how many health clubs are available in your area. And if a client does buy a Medicare Advantage plan that participates in Silver Sneakers, which many do, they would get the access free to go to all of the health clubs in that zip code. So Medicare Advantage is a Medicare option under a private health insurance carrier. We work with a variety of different carriers with independent agents all across the nation. They're all licensed directly with the insurance companies. They're not our employees. And their job is to just help educate your patients on what their options are. Some people are better off staying where they are with their current plan. Some people aren't aware, and these are the people we want to target with our education campaign. They're not aware of all the options that are out there under Medicare. And since the time frame to enroll is so compressed, we're only looking at a few weeks between October 15th and December 7th, which also happens to be Thanksgiving and the build up to the holidays. That small window, we're asking over 40 million beneficiaries, hey, check out your options, make a decision, change between plans, or decide if you want to enroll. So we would like to ask for your help and your staff's help to get the word out, to have people know that they can call our 800 number to get more information, to talk to a local agent about the options that are available for them.